Each year, Microsoft Research hosts hundreds of influential speakers from around the world, including leading scientists, renowned experts in technology, book authors, and leading academics, and makes videos of these lectures freely available.
It's my pleasure to introduce Julie Kientz. I think most of you, or many of you, know her. Julie's out at the University of Washington, right across the lake. She's faculty in HCDE, Human-Centered Design and Engineering, with affiliate positions in, let me look at the slides, the iSchool and CSE. Her lab's really cool. It's chill. The computing for, let's see, healthy living and learning. And Julie's done a whole bunch of really neat work in the health space around technologies and understanding for parents, understanding kids, for kids with autism, and for sleep disorders. And I think she's going to tell us about some of this work today.
Yeah,
so take it away.
Thanks, Desney. Yeah, so I'm one of these, if you ever have any questions about who's doing sort of HCI type work at UW, I'm very intimately familiar with many of the departments. So it's like whole kind of alphabet soup over there. So, So today I'm going to talk to you about health and well-being technologies. So there's been a lot of talk about this. You see lots of articles about how it's going to revolutionize everything around us, and it's going to save us time and effort in being healthy. It's going to save us money. We're all talking about healthcare and how much it costs, and how much it's going to be, how much technology is going to save us money. It's going to allow for continuous self-monitoring, right? So you'll be allowed to track everything, and there'll be nothing that stands in our way in terms of being able to understand ourselves. It'll be easier to use than traditional methods. Paper-based diaries and those sorts of things are also cumbersome, and so this is going to make me much more easier to use. We're not going to have to visit the doctor as often. You'll be able to do this magical transfer of information to our doctor, and it'll all make things wonderful in that way. And ultimately, this is going to lead to miraculous health outcomes. And so I say this with a little bit of sarcasm because we haven't quite met that vision yet. So a lot of people are touting health and technologies as being sort of this holy grail of making the world healthier, solving the obesity problem, solving our sleep disorders, solving all these different types of disorders. But we haven't quite made it there yet. And so the reason for this is what we've been looking at are some of the burdens that have been associated with these technologies. And so in my work, I've come across 7 different burdens that have been manifested in different types of technologies that we found are preventing people from adopting these types of technologies. And so starting with the physical burden. So this is an example of a pediatric patient getting a sleep study. This is actually, they've got pulse oximeter strapped to his finger. They've got a chest strap strapped to his chest. He's got sensors taped all over his face looking at his facial movements. He's got EEG sensors strapped all over his head, and they're expected to sleep with all this stuff on. And this is okay for a single night. Things like sleep apnea can be diagnosed in a single night, so that's why people do it. But if you're looking for more behavioral stuff over the long term, no one's going to wear all these sensors to bed every single night for years, which is a lot of times insomnia is something that you have to measure for very long term. So this physical burden can stand in the way of these things as well. There's also a mental burden associated with things. So having just to remember to whip out your diary and write that you ate that cookie, just to have to remember that has a lot of cognitive load that can prevent people from taking advantage of a lot of these technologies, just remembering having to do it. There's also things like emotional burdens. So people might be familiar with the Wii Fit, which you stand on the platform and you step on it and it tells you that you're obese, and not only does it tell you you're obese, it makes your character look fat. And so you like blue, and it makes it all jiggly, and so there's been a lot of reports that they've been doing this to children, and they've been doing this to people who didn't otherwise know that, and they're suddenly finding out that they're very unhealthy through a technology, and it can be really upsetting to people if they've gone through that. So a lot of times this emotional burden might prevent people from using these types of technologies. There's also financial burdens. So a sleep study can cost around $5,000 for a single night. That's obviously, and this is the U.S. and we've got all sorts of issues with how much healthcare costs in the U.S. But that's pretty cost prohibitive for things. But even things like smartphone technologies, there's still the cheapest plan that we found is $300 for a cell phone, and then I think about $40 a month for unlimited minutes and data plan. This is Walmart's plan. So this is actually the cheapest that we've been able to find And so that's pretty cost prohibitive for a lot of low-income families to be able to adopt these sorts of technologies. So there may be a financial burden associated with that. And then there's the time burden. So technology is supposed to save us time, but if anyone's tried to keep a food journal, then they know how intensively you have to kind of track all these different things. What did I eat, and how much was it? Do I have to measure that out? What was in that? Did it have mayonnaise on it? I can't remember. And so you have to go through this whole process. And a lot of times, even these quick things that are easy to record still take time. So has anyone done the Track Your Happiness application? So they send you a text message, and you're supposed to fill out this quick little survey. It's supposed to take less than 2 minutes or so. And the way it's set up is that you'll do about 50 of these, and then they'll ask you again in 6 months, and you'll do another 50 of these. So the first time I did it, it was great. So I filled it all out. It was, 2 minutes, totally easy. Filled it all out, got this great report about it. And then I had a daughter. And then I got it, it was 3 months after she was born. And I got it again. And the first time I did it, I answered every single one religiously. And then the second time around, it was just my phone wasn't nearby, my hands were full, and it was even that 2 minutes, just putting her down, I was I missed at least, I had to go through 160 text messages to get the 50. And they said I was actually pretty good in that regard. So even just that little bit of 2-minute things took a lot of time and effort to be able to track that sort of thing. There's also the privacy burden associated with these things. A lot of people in the room might be familiar with this, and that's, people might be uncomfortable having things recorded, and understanding how, what the sorts of technology are doing and where it's going. So people might be prohibitive in that way. And then finally, the access burden. So for people with disabilities, it may be difficult for them to actually use different types of technologies because they can't, it's not accessible for them either for visual impairment or for physical impairments or anything like that. Does anyone use things like Fitbit or anything like that? A lot of people are saying, I figured this audience probably is pretty familiar with it. So you're thinking about sort of the time burden. This has come up for me also as well. So I've been interested in tracking sleep, and the Fitbit is one of the easiest things that you can do to track sleep. You're supposed to put it on your wrist. There's a little sleeve that comes with it, and you put it on there, and when you start and stop you have to start and stop it telling it when you went to sleep at night. And this is based on accelerometers. This is actually the gold standard according to the health industry and tracking sleep off the shelf, believe it or not. It took 20 years for them to appreciate that this was actually a technology that could be used for sleep. And there's all these caveats about how it should only be used in healthy patients and things like that. But as simple as this technology is, in our experience, we've actually given this to people, and they almost always forget to push that button, or they forget to stop it. And so even just this quick little thing that they're supposed to do, start and stop, that combines a lot of things. It combines the mental burden, the remembering having to put it on their wrist every night, and having to remember to do those sorts of things can be prohibitive, even if it sounds like it's conceptually simple. So our kind of theory for the stuff we've been doing is that if we can try to reduce a lot of these burdens associated with these technologies, we might be able to lower the barrier and get us closer to those envisioned uses that people have been touting for health technologies. So that's sort of the theme that we've been doing in a lot of our work. So first I'm going to talk a little bit about understanding these burdens. So we've done some work on looking at different aspects of burdens. So lots of people have done stuff on things like mental burden, and so we want to explore some of these more subtle burdens as well. So the first one I'm going to talk about is the emotional burden associated with these type of technologies. So remember the Wii Fit example of finding out that you're obese through a technology. And we were actually kind of fascinated by this, about and we'd been designing a technology for parents and tracking young children's development. And one of the outcomes is that your kid could have a developmental delay or things like autism. And how do you find that out through technology? That just seems really, that could be really uncomfortable. And so this is one of the things that came up when we did an initial study of this work is, how do you convey this information that their kid might be behind, that they may have delays, and how do you do that in a way that is motivating enough that they'll do something about it, but not going to make them super, super obsessive or scared of checking the technology. So one of my students went through and she interviewed a lot of people who had been diagnosed with some sort of terminal or chronic conditions. So she interviewed people with cancer, with Parkinson's disease, people who had I think she also did diabetes and all those sorts of things, and really trying to understand what helped them when they received this diagnosis for the first time, and then also what hurt them. So talking about both the good and bad about what happened to that. And she was hearing all these stories about one person had used a personal health record when she was pregnant, and she got a notification that her test results for one of the prenatal tests was available, and all it said was result abnormal. And there's no context to it. There was nothing that they could learn about, like, well, what does that mean? It was the test that they do for Down syndrome, and all it meant that she had a greater than average chance. I think it was, instead of like 1 in 3,000, it was more than 1 in 200, and there's no explanation of that. It just said result abnormal. And she was obviously, it was like 10 o'clock at night. She couldn't call her office to get an explanation. She's up Googling all night about, what does this mean? What does this mean? And so that's really kind of heartbreaking to find that out. But on the flip side, we don't want to hide that information from people either. If they have test results, it's important that they get this information as soon as possible so they can be proactive about it and engage with it and do something about it. So we have to try and strike this balance of getting the information to them in a way, but something that can acknowledge the fact that this might be emotionally burdensome, and helping them deal with it. So in addition to interviewing the patients, we also looked at the doctors. So we interviewed a lot of people who had given these diagnoses, talked to them about their training. We also reviewed the medical literature to look at how they train new doctors about how to convey this information to people. And we found a lot of really great information. So a lot of times doctors try to insist on doing this face-to-face, but at the very minimum they try to do it over the phone, or at the very minimum making sure that if they release test results, that there's some sort of note associated with it that they can provide this sort of explanation. And so some of the things that they find is, again, wanting this information, but in a way that sort of acknowledges that there's a problem, that this could be sensitive. This could be hard to hear, but I just want to let you know that you may have the precursors to diabetes or something along those lines, or you have a tumor that may be giving that sort of acknowledgement that they may be feeling something anxious. Also, we learned that using team language is important. So instead of saying it's like, you have cancer, or you have to deal with this, you think about like, oh, we're all in this together. We're going to work together to make sure that you get the best treatment that you can. And talking about using this sort of team-based language is really important as well. And then also just simple things about connecting them to where to find more information, what can I do about it? Because that seems to be, when we were talking with patients, that seemed to be the biggest thing, is that the first thing was like just feeling completely helpless and not knowing what they could do. So just giving them some simple things about what do I do next is sort of the most important thing there. So we've been trying to translate these into design guidelines, and we've got some work that's under review for that. But I'm happy to kind of share that with people if they want to see that more. The second thing we did was actually with collaboration with Jae Young here. The student was looking at how people, when they put things like sensing and inference technologies in the home, how they might react to that. And so you can ask people just how they feel about it, but a lot of times people don't know what they're doing, and they also don't think of all the different situations in which they might be recorded and whether or not that's going to be problematic. And so what my student did was she did a cultural probe where she brought people into a lab setting and interviewed them on, she gave them a patient education session on what sensing and inference was and what kinds of things that could be recorded, what types of applications you can use it for. And she got their initial reactions. But then instead of just kind of taking that interview data and looking at it, she sent them out back to their home with what we called sensor proxies. And so you can see this in the picture here. They're just very simple motion-activated lights that she put a little cover on. And she asked them to place them in 4 different rooms in their house. And whenever the light turned on, they're supposed to be triggered to think about, what was I doing just now, and how would if I had been recorded, how problematic would that have been? So she kept them with a logbook so they could write down their thoughts. And then she also worked on keeping a guest book, so other people who had come into the house, and then had them take pictures of the different rooms that they placed it in. And so that was really great, because we were able to get their receptiveness to these sorts of things in context, to get them think about these kind of corner cases. And so, for example, one of the lights had gone off, and the participant's child actually saw it and said, like, oh, what is that for? And it sort of sparked this conversation. It's like, oh, and she kind of explained the study. The boy was 7 years old, and sort of explained the study to them. And the mother explained to herself, like, well, I don't know if I would have wanted to be recorded just then. It's like, that's a private conversation. And so and she hadn't really thought about that case when we interviewed her first. So you're thinking about those sorts of things was really important for that. So we put them in the houses for about 4 weeks and prompted the users to reflect on those things. And then we brought them back into the lab to ask them. And we actually found a lot of people sort of change their mind about things that they thought that were problematic, no longer become a problem by the end because like, oh yeah, I thought about this use case, right? So this actually would make it really important. So I didn't think I wanted cameras in my house, but then I thought about, well, I have a child with disabilities, and that actually would have been really important to know like what they were doing and if they're in some sort of troublesome situation. So it not only did it make them more concerned about privacy for some things, but it made them less concerned about privacy because they could see the application of it by having reflected on it for a long period of time. So, but the other thing was just like, thinking of, when I talk about the mental effort associated with this, there's also just this thought about like thinking all the time about what's being recorded and when and in what rooms, and trying to help them understand what all these things are can be sort of a mental burden for that as well. The third exploratory stuff that we looked at was specifically in the context of an application design space. And so we've been interested in doing a lot of stuff with sleep. And so we did a formative work in trying to understand what this design space was and what's already out there, what people are willing to do, and what sort of the opportunities are. So we conducted a large-scale survey and interviews to determine the acceptability of sleep technologies. So what are people currently using? What are they willing to be used? What sorts of things do they want to track and those sorts of things? And we used that information to develop a design space framework. So this was combined with a literature review to help them map out sort of what the different opportunities and challenges are, as well as what's currently being done and what opportunities there are for additional design. And so specific to the different user burdens that they come across is that people were pretty adverse to wanting to wear things to bed. And so unless they had something like, they were used to wearing a sleep mask or something like that, they were pretty aware that they didn't want to be wearing stuff to bed. It might be uncomfortable. People actually kind of wake up a lot if they think they're being monitored. So they were really conscious of not wanting to wear anything to bed. Even just the simple little thing on their wrist was problematic. Yeah.
Excuse me, when you say not willing to wear anything to bed, is it an issue of just how invasive it is, or like how uncomfortable it is?
It's comfort, yeah. And so like things that would be built into clothing, I think people said that they would be okay with. So things that like, smart fibers and things like that would be okay, but things like having to put something on their wrist or especially on their head, which is some of the approaches have a head-worn thing. And
But they have clothes that they consider comfortable and pillows?
Yes. Yeah. So there's other opportunities, but they didn't like the idea of having body-worn things because we showed them the different options that were out there, and so they were a little bit conscious of putting anything on their body, and I know this is anecdotal, so I shouldn't talk about that, but so just in my own experience with wearing these things, I'm always constantly worrying about it coming off. I've worn the Zio headband, and it's left a red mark on my forehead because I was so conscious of it falling off that I pulled it really tight, and it left like this. I was like walking around like looked like Cyclops during the day because it left this red mark on my forehead. And the other issue is that because the reason I was so conscious about it was because if it slipped off in the middle of the night, I lost the whole night's worth of data. And then like, oh, I wore this for nothing. I didn't get any data from it.
Do you have an intuition as to like how something like a pillow would be accepted if the nature of how your face interacts with it doesn't change, but there's something inside of it?
Yeah, so people are kind of picky about their pillows. Like some people will sleep on anything. We have also told stories of people who filled their suitcase with their pillow and took them to every hotel with them because they just had to have their special pillow to sleep. So I think it's pretty variable from person to person.
Is it a lot of people that it's like a very personal choice?
I think so, yeah. There's some, I can put you, the National Sleep Foundation does a lot of these huge polls that looks at things like sleep environment and things like that. And they've done one in terms of bedding and mattresses and things like that. So I could point you to that if you want really specific info on that. But yeah, just hearing from the people in our study, there's people are a lot of times people can sleep anywhere, and a lot of times people are so sensitive that they're really really adverse to those sorts of changes. The other thing is that just thinking about being recorded while sleeping is also disruptive to sleep itself. So that was sort of problematic as well. As like if they thought about it, especially if they're like, is this on? Oh, I just woke up. Do you think it recorded me being awake? And so there's a lot of this sort of concern about just this stuff going on in their head about what's being recorded in the middle of the night that was actually doing the opposite. So instead of helping them sleep better, it's actually making them sleep worse. And so some people we talked to who are doing long-term sleep tracking got used to it over time. So it is sort of something that you can get used to if you've been doing it enough. But those initial weeks, having lots of people try these things out, people were just like, yeah, I felt like it was kind of weird. I thought it was, I couldn't stop thinking about like, oh, did it pick this up? I moved. Does it think I'm awake or does it think I'm asleep? Yeah.
It did a couple of years ago, like inadvertently they said the privacy settings on your sleep stuff was public. And,
oh, yeah.
Oh, activity, sex.
Right, yep.
Oh,
Yeah.
That's awesome, thank you for sharing.
Yeah, so that's actually a great point. So the bedroom, the other things that we came up with, thinking about the privacy burdens, that there's a lot of stuff that goes on in the bedroom that you may not want recorded as well. So when I talk about the next study, I'll talk about some of the particulars that we came out when we were recording in a bedroom environment, and those things certainly came up for sure. So this was our sort of testing the waters of what the design space for sleep was like. And so the main things we're looking at were, it needs to be really easy to use. The other issue is that when people are going to bed or waking up in the morning, I don't know about you guys, but when I go to bed at night, it's usually I'm exhausted, and it's like I don't want to spend a lot of time doing anything before I go to bed. It's like I want to just kind of brush my teeth, get my PJs on, take my contacts out, and go to bed. And just even that little act of like, oh, did I get oh crap, I left it downstairs, it's charging, I have to go downstairs and get it and put it on my wrist. That just adds this sort of extra step. Same thing with like keeping a journal. Then on the other side, when you wake up in the morning, the first thing I want is a shower and coffee. And so I don't want to necessarily be thinking about like, oh, how long did it take me to fall asleep last night? And how many times did I wake up? Oh, I went to the bathroom at like 3 in the morning, or my daughter woke me up, or the cats came in. It's like sleep doctors want you to record all this information, and it's hard to do first thing in the morning. And so that was sort of the nature of sleep itself sort of made it difficult to do these sorts of manual types of recordings as well. So that was the sleep technology stuff. So any other questions at this point?
So
yeah.
What I take away from this is you basically need a technology that if you use it properly in the night, automatically rewards you with a coffee in the morning.
That'd be great. Yeah. It has to be before a certain amount of time, as I'll tell you with one of our other technologies, is if you do it too late in the day, then that can be problematic as well. So that was sort of the formative work and sort of understanding what these different these designs associated with burdens are about. So we looked at a lot of the literature for things like mental burdens and things, but we specifically delved into the emotional burdens, the privacy burdens, and the physical burdens associated with sleep. Yeah, Dan?
Sort of philosophical question, so
Sure.
I'll be happy if you want to punt this to the end of the talk.
Uh-huh.
Everybody basically accepts, I think sort of society accepts that managing your weight has a clear impact on your happiness and your lifespan. Not everybody does something about it, but basically everyone is sort of on board with that.
Right.
Smoking, I think largely thanks to the press, smoking, we're on board with the fact that these things affect your happiness and lifespan. I used to be sort of a sleep skeptic, but everybody knows how to sleep. I'm totally on board with like sleep is up there with managing your weight in terms of your daily happiness, and maybe not the same impact on your lifespan, but certainly on quality of life for the rest of your life. It seems like the press isn't interested in how people don't seem to have that same socially accepted wisdom that sleep really affects your quality of life, and that itself is a barrier to adoption. Like certainly that regulates your threshold for what is too uncomfortable to put on. Do you have thoughts? This is, like I said, very philosophical, so happy to punt to the end of the talk. Do you have thoughts on like what one might do about that, or do you agree or disagree?
We're thinking about that exact problem, Dan. It's like you're a plant. So one of the things that we've been thinking about is how to prioritize sleep. So when I talk about some of our other studies, we found people that were making the choice to I want to go out with my friends. I don't want to go to bed at midnight. It's like, even though that's what the doctors say, it's like I prioritize my social life over my sleep. Or if they're thinking about like, oh, I don't get off work until 9 o'clock and I need to exercise at some point, I need to do that before I go to bed. So should I do that or should I sleep? And it seems like to me exercise is more important. And so there's definitely these sort of trade-offs, and sleep always seems to get the short end of the stick for almost everyone. And so the interesting stuff, so we've been engaging with a lot of people in the sleep community, is that people are really, really bad about knowing how sleep impacts their life if they've never thought about it. So they've done all these studies where it's the type of studies where they take undergraduates and sleep deprive them for like weeks at a time And then they do all these sorts of objective measures about it. And so they pay them a lot, and the IRB for that's all are pretty tricky. But so they do these sorts of studies, and they'll say, okay, or they'll get people getting like 6 hours of sleep every night, and they'll have them talk about, and when you ask them, they say, oh yeah, I feel pretty good, it's fine, I think I'm totally okay with it. But they do all these objective tests, and their reaction time's way slower, their memory's slow, their mood has gone down, they're having more arguments with people, and so they're just really bad about understanding the impact that sleep has. And so one of the projects that we're looking at is helping actually people realize that. So I'll talk about that in a little bit, but we have definitely been thinking about that problem for sure. So. Okay. Oh, I think I have a stray animation in there. Sorry. So I'm going to talk about 4 different types of technologies that we've been looking at for reducing some of the burdens associated with different healthcare stuff. And I'll start with 2 from the sleep domain, since we've already been talking about that. I'll talk about 1 from the parenting domain, and then 1 from the physical fitness domain. So the first one I'm going to talk about is an application called ShutEye. So this is in collaboration with some of my PhD students, Sunny Consalvo and Brent Greenstein, who are now at Google, and Nate Watson, who is a sleep technologist. So he was actually a participant in our initial sleep study. We did a contextual inquiry at the UW Sleep Lab, and he was just so fascinated by the thought of using technology for sleep that he ended up becoming a collaborator on a lot of our different projects. So. But when talking with him, he talked about this notion of what sleep hygiene is. And so when you think of things like hygiene, you think of dental hygiene, like brushing and flossing your teeth and those sorts of things. But it turns out there's such thing as sleep hygiene as well. And so these are sort of the little things that you do throughout the day that can have an impact on your sleep at night. And so there's a whole list of things. Usually if someone complains of sleep problems, the very first thing they do is they give them this list of sleep hygiene recommendations. And so this includes things like getting consistent timing of sleep is actually more important than duration. So things like going to bed at a consistent time every night is actually pretty important. You're getting between 7 and 9 hours of sleep is important. Not drinking caffeine within 8 to 14 hours of bedtime. Not exercising heavily within 3 hours of bedtime. Also things like not watching the clock at night. Only using the bedroom for sleep and sex is actually listed on the list because you start to associate your room with, like if you work on your laptop in bed, you start to associate things with being awake at night. And so these are sort of these things that you can do throughout the day that can have an impact on your sleep. But the problem is, like, remembering to do all these things at any given time is pretty problematic, and it's hard to think about these things. And I'm pretty big on getting coffee every now and then, and thinking about like 8 to 14 hours. Like, well, if I go to bed at midnight, it's like, what does it end up being? And so these sorts of things are pretty hard to remember to do all these things throughout the day. So what we want to do is look at how we can use these sort of time-based things and make it easier for people to remember these sorts of things. And so this is just a subset of the things that we looked at, but things like napping. Napping's really only recommended in that kind of 1 hour after lunch sort of window. And it actually doesn't matter when you woke up or when you went to sleep. There's just a natural dip in your circadian rhythm right about the 2 to 3 window time frame. That's an important thing. If you're going to nap, that's the only time of day that if you do it, it's not going to impact your sleep later on at night. Meals, 3 hours before bedtime, you shouldn't have a heavy meal. Alcohol, this one is actually counterintuitive to me because you always think about like people drinking a glass of wine before bed to sort of unwind. And it really does help. You go to sleep, but as soon as the alcohol oxidizes, you get a spike back up in your circadian rhythm, and it wakes you up, and it can disrupt your sleep through the rest of the night. Then they also recommend doing relaxation activities in the hour before bedtime. So doing like crossword puzzles or reading or those sorts of things to sort of unwind and do things before your day. So these are just sort of time-based things that we come across that are important for maintaining good sleep hygiene. And so our design question was, how can we make people aware of these sorts of things, but armed with this knowledge that people don't want to record a lot of things, they don't want to spend a lot of time doing these things. So how can we do this with the most minimal amount of effort possible on the part of the user? So we didn't want to have to remember these sorts of things. We didn't have to want to make them wear anything. We didn't want to have to make them record anything whatsoever. So we tried to do the most low burden approach that we could think of. So we developed an application that runs on Android phones, live wallpaper. And so what it is, it just runs in the background screen. And this is a timeline throughout your day. And so you've got the different sorts of activities that might impact your sleep. So caffeine, napping, exercise, meals, alcohol, relaxation. We also have nicotine use, but people could turn that on and off depending whether or not they used it. And you could also add custom things like medications, or some people had things like they thought TV watching might have impacted, so they could add custom things like that. Basically what it is the idea is that you can get a simple glance whenever you're looking at your phone, checking your text messages or emails, and get a sense of what the current time is and whether or not if I do those sorts of activities are going to have a negative impact on my sleep. So the vertical line represents the current time, and if the bar for a given technology is thick, that means if you do it, it's going to be fine. If it's thin, it means that you probably shouldn't do that now at this time. Yeah, Scott?
There's no phone use on there.
Yeah. So the important thing is that we only took stuff that there's actually research from the medical literature on using these
So the phone
things.
doesn't tell you shouldn't be using it.
Right. Which is actually interesting because research came out since we've done this that indicates that certain amounts of blue light can actually disrupt your melatonin levels. And so they're not recommending having anything that emits blue light within the hour of going to bed. So yeah, so that'd be one of those, we could have it automatically shut off or something like that, but yeah. They could have added phone use as a custom thing if they wanted to.
Or you could change the interface to be all red light
Yeah.
after a certain time.
Actually, I think there's some filters that you can get for Mac OS that will remove all the blue light that is emitted from your screen, so you can do those things as well. So the idea with this is that you can also scroll and look ahead, right? So it's like you take a look at it and say like, oh, like coffee is not really recommended after about 3 o'clock, so you can scroll ahead and look up, oh, I've got a good amount of time for that. And so the idea is that you could really quickly, easily look at those things. The only thing that we required is that when they first started using the technology, they just had to estimate their sort of sleep and wake times that they normally do, and then everything else was set. So they didn't have to change anything. They didn't have to do anything at all once they got the initial technology set up. They could always go in and read about these sorts of things too. So we had like the specific literature that cited why this was the case, so they could learn a little bit more about it as well. And so we did a deployment study on this. And so we did a 4-week deployment with 12 different participants. And so we brought them in. We changed out the SIM card if they didn't currently have an Android phone. So they were using ShutEye on their primary phones that they're using for making phone calls and texting and everything. So we mostly had a lot of qualitative findings on this one, but we had an increased sense of awareness in general. So we asked them a lot of things at the beginning of the study. What sorts of things are impacting your sleep? What do you know about alcohol use? And asking them lots of questions. And a lot of people sort of had these vague notions of it, but then by the end of the study, they just sort of had this much more impactful sense of oh gosh, I drink a lot of coffee, and they sort of just had this bigger awareness to it. The other thing is that because ShutEye was cyclical and it reset every day, they sort of had this desire to almost stay within that schedule. They almost used it as sort of a goal, right? It's like, oh, I've set this goal for myself that I'm going to be in bed by 10 o'clock. And so they sort of saw the ShutEye slowly getting towards there. And it was almost sort of the subconscious motivator to get them on a sort of a different type of sleep schedule. And then they had a better sense of just the different factors. So like a lot of people thought that alcohol was actually good at getting them to go to sleep. And so they understood that a little bit better. We did some initial exploration into the efficacy of it. It's hard to show behavior change and efficacy in a 4-week study, but we did a measure anyway. So we used a standardized scale called the Epworth Sleepiness Score, which is just an 8-question scale that results in a numeric value between 1 and 20. And so we did see improved scores for 8 of the 12 participants. 3 people stayed the same through the course of the study. And this person really ruined our results. So she actually got worse. So she started out with pretty good sleep, and then she ended up getting worse sleep by the end of the study. And when I talked about how people don't prioritize sleep, she's told us at the end of the study, she's like, I think I learned in the study that I don't care about sleep. So she was, she's pretty young. She liked to go out and go party and things like that. And this just helped her think, it's like, oh, if I sleep, I have to sacrifice things like alcohol and get to bed at night. So we actually had a reverse impact on one person in our study. So that was a little bit disappointing, but we did see some promising results for the rest of the participants as well. The other interesting thing, and this goes down to just knowing a little bit about how the different designs you have can impact people's perception of things. And so the recommendation says that alcohol can, it doesn't have an impact until you're about within an hour or 2 of bedtime, right? So we just showed that it was fine to use any time of day. But if you look at the display, it looks like we're encouraging alcohol use at 7 in the morning. And so people are like, wow. I was like, oh, I can drink alcohol now. It's like, it's 7 in the morning. So things like that are problematic. The other thing is that because we had sort of a hard edge on when things ended, it's not actually the case that it's a hard edge. It's definitely more of a window, right? But people thought that this was like, oh my God, I got to go get coffee really quick before 3 p.m. And so, yeah, I think if we redesign it, we would have more of a subtle transition as opposed to like a hard stop. So just these little tiny design decisions were actually having an impact on how people thought about things. So that was actually really fascinating to think about. Yeah, sure.
About the UI.
Yeah.
Were users able to sort of set their own timelines, like
yes,
okay,
so we use the literature-based recommendations for setting the initial ones, but they could go in and edit it. So the recommendation for caffeine is like 8 to 14 hours, which is a pretty big window.
Yeah.
And some people, if they have 14, it's definitely 14 hours and they know it. But for some people, maybe it's a little bit less than that, and so they were able to go in and edit that if they needed to.
Did you find that they did that?
Not too many
even
people
bothered?
did. Again, it's one of those things like defaults are really strong, right? And so people, they just didn't go in and edit it as much as we would have expected. So, so that's why the importance of setting really good defaults is always an important thing. So yeah, great question. All right. So any other questions on ShutEye? Yeah, Dan.
Did you also find out how many people kind of violated the guidelines?
Yeah, a lot of people did. And so, but the nice thing about it was that they were kind of just conscious about it. It's like, well, I know I'm going to have this coffee now, and I know it's going to impact me. So they're just, even if they didn't follow them, at least they were thinking about the consequences of it. And so we thought that they were making more, mindful-based decisions about the types of things that they were doing. So we didn't have a way of measuring alcohol intake, and so we couldn't, get a quantitative measure of these things, and it is based on self-report, which is a little bit, there's the limitations of that. But yeah, we did see some people who were consciously violating it, but at least they were more mindful of it. It's like I drank coffee, but I felt guilty about it at least. So yeah.
Look at the time that people took to fall asleep, because I'm assuming that this is a very complicated area in the sense that any awareness. It might actually impact how you sleep, because, for example, if I start thinking, oh, I need to sleep, then I don't sleep.
Yeah, we didn't, because again, we wanted to try and do like completely no instrumentation whatsoever. And so I think some future work with this would be to include some sort of sensing to look at this, because right now it was just set based on sort of their ideal sleep and wake times, which isn't always what people did. So it might be a little bit more accurate if we had some sort of unobtrusive sensor that could sense these things and automatically adjust it. And then also sort of find out what those things are as well, right? So when I say that caffeine's 8 to 14 hours, finding out what it is for me might be important too. So if we had some sensing to make this a little bit smarter, then we can think about like, well, caffeine measurement actually is happening more for you, more about 6 hours, because when you take it, then it's going to be along those lines. So I think with some extra instrumentation, you can make this a little bit more powerful, but our goal was to make the user do absolutely nothing. And so I think it was pretty successful in at least getting people aware of those sorts of things. And I think there's more that you can do with it though. Any other questions about ShutEye? Okay. I'm going to talk a little bit more about sleep as well, with a different type of approach. So when I talked about sleep hygiene, so when I talked about sleep hygiene, I mentioned things like the time-based ones, but there's also environmental based ones. So things like sleeping in a room that's fairly cool, free from distractors like light, or sleeping in a room that doesn't have a lot of sounds in it. They recommend not having pets in the room with you. They not recommend like keeping children in the bed with you. And so there's all sorts of things about keeping your sleep environment very pristine, which people who have kids and pets and things like that know that that's very difficult to do. But we wanted to help people understand what they're doing, because some people can sleep with their kids in their bed and it's not a problem. So some people can also sleep in a warm room and it's not a problem. And so how do we find out, these sleep recommendations are based on a general population, but how do we help people find out what's actually impacting your sleep? So that way, do you actually take the trouble of making sure that the cats and things are kicked out in the middle of the night, or is it okay for you to actually have them in bed? So our goal was to help people understand their own sleep environment and also what's disrupting their own sleep. So we wanted to allow people to explore what's happening when they're going to sleep at night in a home setting that minimizes the privacy, physical, and time-based burdens. And so privacy is really important in this one because a lot of things go on in the bedroom, like I mentioned, that you don't necessarily want recorded. But it's hard to figure out what your disruptors are unless you're recording. So we had to be really conscious about the privacy concerns going on with the recording in the bedroom. So we used a lot of the information from the privacy study that we talked about to kind of think about how to design these sorts of things. And so what we ended up coming up with is a system called Lullaby. We had a lot of fun brainstorming, lots of like sleep-based terms for the names of our projects. So what it is, it's a bedside appliance, about the size of a table lamp. It's a research prototype, so it looks a little bit scary at times. But it's got 2 motion sensors that you can, they're on posts that you can turn. So we recommend one is pointed at the bed and one is pointed at the door to the entrance to the bedroom. There's a sensitive microphone, a temperature sensor, a light sensor, and an infrared camera that snaps a picture every 15 seconds. So it gives you kind of night vision view of what's going on in the room. And so it's got a tablet-based interface that will allow you to get a quick sense of what's going on in the room. So just a green, if the noise level or motion is going on. If it's green, it means your conditions, within the recommended range of sleeping conditions. If it's red, it means it's outside the recommended range. So you can also get a quick snapshot of what's been going on in the last 5 minutes or so. There's a quick snapshot of what's going on in your room. And then those privacy controls, we wanted to be able to people to really easily turn off the recording and on the recording. We also wanted them to be able to just quickly delete anything that had gotten recorded right away as well. So with one button, you can just delete what happened in the last hour. Yeah.
How close was that to somebody's head?
So we recommended putting it where you put your alarm clock or so. Yeah. So it's fairly close.
Did you find that any of all that electricity next to someone's head was kind of?
No one in our study reported that. We were really conscious about but things like blinking lights and stuff. Were actually pretty important. We had to go through with electrical tape and tape off every little blinking light. A lot of the little power adapters for the sensors had lights on them.
Noise or the humming of things?
Yeah, so it had initially included an air quality sensor in the initial design, and that had a fan on it that sucked in the air particles, and it made so much noise that we're like, okay, we got to get rid of this. So we were pretty conscious about that. We used it on ourselves at first. We're like, oh, I can't sleep with this air quality. Yeah, it's a little bit noisy. Same thing with sort of the lights and things like that. In terms of electricity interference, we didn't get too many people, or we didn't get anyone in our study that complained about that. But yeah, I think that's something that's definitely worth exploring. So the idea is that it's capturing what's going on while you're asleep. So, which actually ended up being pretty interesting because a lot of stuff happens in your sleep that you don't know about. There's been a whole class of sort of applications that have looked at capturing different types of things. Things like meetings or time you're playing with your kids or classroom activities, and then being able to record and review those things later. And we found that most people don't look at that information because they were there. Only if they need to remember something important do they go back at it. But if you're unconscious during what happened, people actually were super fascinated by this. So it's kind of interesting. I'll talk about that in a little second in our study. This is the more detailed view. So this gives you a readout. So this is a sleep cycle that you had. So we had people wear the Fitbit. And so despite all the limitations I talked about with the Fitbit, that seemed to be the best compromise for getting sleep sensing right now. But we've got some ideas for how to remove that component. But for this particular study, we did use the Fitbit for that. And so you've got your sleep throughout the middle of the night. And so the Fitbit's telling you all your awakenings. And so what you can do is if you see awakenings, you can go back and look at the different sensor streams and you see if there's anything there. So was there a spike in the light levels? Was there a spike in the motion levels? Was there a spike in temperature? For this particular example, you can see there's actually a fan running throughout the night. So you see a lot of motion from things just blowing up and picking up from the fan throughout the night. They had a pretty disrupted sleep also throughout the night. So the other idea is that if you see a spike there, you can also slide this little bar here to that particular moment, and then just hit play, and it will go back and replay both the audio and it's kind of hard to see here, but this is the night view of my student sleeping. But you can actually see what was going on in that frame, as well as play back the audio. So you could say like, oh, that was when my cats actually started scratching at the door. Or that was when I got that phone call in the middle of the night from this random person in Europe that forgot and pocket dialed me. So you can kind of see what those things were that were interrupting your sleep. There's also privacy controls. You can go back and delete big chunks of data at a time because again, the environment that you people are sleeping in can be pretty private. And so we went through and allowed people to easily do that. It looks like your sleep is very remarkably the same throughout the night. So these are just the different visual images. So people could just delete whole chunks of data at a time. So they could just tap on things and just quickly delete them. And so we did a small study with this one. So we did a 2-week study with 4 participants. And so it's always one of those things like, how long do you run your study for? And we're actually pretty lucky that it's pretty well regarded in the sleep community that 2 weeks is about the time it takes to get a good snapshot of what people's sleep environment is. And so, so we did a 2-week study with 4 different participants. And so each of them had the Lullaby for 2 weeks. And so we saw pretty high access rates. So I mentioned that, people were just fascinated by what went on in their sleep. So they'd see all these spikes in like the motion sensors, like what's going on there? I don't remember getting up. And so they actually went through and used the system quite a bit. We saw one participant saw this constant spike in the audio stream, and she's like, what's going on with that? And it turns out she was coughing in her sleep and she didn't even know it. She went back, played the audio, and she'd just hear this, like almost consistently throughout the night. She didn't, she slept by herself. She didn't have a sleep partner or that she slept with, and so that was something that she didn't know about herself. And the other participant, he saw some motion in an awakening. The Fitbit showed an awakening on here. He's like, I don't remember that. What was going on? And he's noticed that his room, the door to his room had been closed when he woke up in the middle of the night, or when he woke up in the next morning. He's like, well, I always sleep with my door open. What's going on there? So he went back, he used Lullaby to go back and play. His cats had come in the middle of the night, and he got up, kicked them out, shut the door, went back to bed, and had no memory of it whatsoever. So he actually discovered, and that happened like 3 times throughout the study, and he was just, whoa. It was like kind of really creepy. Yeah.
I find that having control over what data they could delete and take out was enough consolation to get over the fact that there's a camera watching you, because that would, like, I imagine pretty readily trip the creepy factor. And
it was definitely varied by participant to participant. So some people were really conscious of it. Like one person had a really small apartment and she changed in the room that it was going on. So she was very conscious about making sure it was the recording was completely turned off at that time. One participant didn't care. He was also the type of person that when we asked about like your routines that they did before bed, he was very forthcoming about the types of things that he did in his bedroom and made my poor graduate student blush like crazy. So for him, it didn't matter as much. And so I've got a view of the different deleting patterns that people did as well, which I can show you here. So, and this is a chromogram of what was going on throughout the night. So the light blue indicates the sleep periods. And so the green is when they're viewing the history screen. The home screen was visible, and then the delete screen. And so the first person was the one who did changing in the bedroom. So she was pretty conscious about going through and deleting things. This is the guy who's, like I said, mentioned very forthcoming, and he only deleted 2 things across the 2-week period and was very open about what those things were. And this guy, he actually had his wife with him, and they would have a lot of private conversations around bedtime. And so that was important for her. And he didn't care, but his wife cared. And so she was very much like, oh, make sure you go back and delete that. And this guy was mostly just kind of playing around with things. Then he's like, there's nothing there that I really am worried about. So he just didn't end up deleting anything for the rest of it. But yeah, it's a good question. And so it's really kind of interesting to see that people are actually bringing up the history almost every day. So you might expect to see sort of a novelty effect where people are really looking at it a lot in the beginning, but people seem to be using it throughout the whole week, which is kind of promising for this, that there was this sort of fascination with what was going on in the middle of the night, that people just don't know what's going on. And so we've been taking this work a little bit forward and looking at things. So right now we just kind of show the raw data and allow them to do it, but it's kind of hard to make those comparisons yourself. So we're looking at things like looking for correlations and doing alternate visualizations that show like just simple text-based things. Like it looks like when the temperature is above the recommended level that you're having more awakenings. So these sort of insights about what's going on with their data, because people can get overwhelmed. Some people are really fascinated, would look at it in really depth, but some people are just like, oh, it's too much for me to look at. So those are sort of things that we learned there. We're also we're working with some people in rehabilitative medicine at UW on using this with multiple sclerosis patients, because they tend to have a lot of awakenings at night. Some of it's associated with their pain, some of it's associated with other sorts of things. So we've been using this to sort of identify the different disruptors that's going on in their life. Yep.
It sounded like at least some of the participants had partners while they were sleeping.
Yeah.
How did you tease out the movement or the quality of sleep between two people?
Well, the sleep was a wrist-worn thing, so it was only worn on the participant themselves. But the movement, there's a lot of stuff from the partner as well. So partners are actually a big source of disruption based on our literature that we found. So snoring partners is important, waking up restless partners. So those sorts of things should be captured, and then they were able to look at that. But
I was just thinking like I like sleeping when it's cooler and she likes sleeping when it's warmer.
Yep, yeah. So there was some of that as well. So definitely fighting over the thermostat for one of the couples was there. And so that's hard too, because then you have to think about finding a compromise for those things. Because if you talk to the sleep doctors, they're very extremist and they're like, we'll sleep in separate bedrooms. And it's like, well, that's not going to work for most people, right? Most people like sleeping with their spouses. And some people like sleeping with their pets in their bed, and there's sorts of things that people are making trade-offs for. And so this is why we think this sort of tool is useful for helping them understand that for me, my partner was maybe moving all night, but it actually wasn't disrupting my sleep. So I'm not going to kick her out into the guest room. My dog sleeps on our bed, and I was using this for a couple of nights, and there was some motion going on, and she got up and did things that didn't wake me up. So I was like, well, okay, I think for me it's okay to violate this principle, because for me it's not having that impact. So yeah, so the multiple partners thing I think is another interesting exploration of how to kind of merge the two, because fighting over blankets and things like that can be troublesome as well. Any other questions about Lullaby? Okay, yeah.
So with privacy concerns, I'm curious, what were participants' expectations with how much data the researchers would see, or if they were to use it for a long term, how long would their data be kept? And
So we have to, at UW we have an IRB process, so we had to tease out all these details about that. And so we told them that we sat down with them before we ever did it and said, sure, we're going to show you how to delete everything so you're not going to see it. And some people said they didn't care, and they're like, oh, just use whatever data you want, I don't care. But for others that was important, we sat down with them and deleted all the data with them. And the use case for this is that it would be just for their own personal use. Because they were in a study, obviously, then they were giving the technology back to us. But if it was for personal use, then I think it would be less problematic. Because there's this sort of trade-off between deleting your data and then having good data to be able to watch and look at, right? And so some people were a little bit conscious about, the researchers might get this data, but the one guy who didn't care, he's just like, if this was my own, I wouldn't do anything about it. I just let it record all night long. So, thinking about who's going to access the data is definitely an important consideration as well. All right, so I'm going to move on to now a different point of view. So sorry about the little animation thing there, stray animation I didn't think about. So flipping around to a completely different thing, and something that's been on my mind a lot lately is how do as parents sort of understand the sorts of things that are going on in our kids' life and know that they're developing well and things are on track. So I've been teaming up with, it's a Washington State initiative for, their goal is to track every child from birth through age 5 and get them regularly screened for meeting different developmental milestones on track. And so they want to make sure every single child in the state is covered. So right now there's a similar system in place for vaccinations. So anytime a child gets vaccinated, it goes into a central database, and then anytime that they go to a doctor, they can bring up those records. And so they want to make sure that they're getting them regardless of income, residency, or background. And so the screening process is 22 different questionnaires across a 5-year period. And each questionnaire asks if children have met 30 different milestones. And so by milestones, I mean things like, does 8 months, by 8 months, does Samuel turn his head in the direction of a loud noise? So if he's not responding to that, then that could be a sign of hearing loss, or also sort of cognitive impairment sort of manifest as not reacting to sounds. At 14 months, does Sally play with a doll or stuffed animal by hugging it? So that's sort of a socially important thing to recognize that you hug things that look like humans or animals. So that's a social thing. So again, things like autism might be manifest by not showing those sorts of activities. And by 2 years, can Aisha kick a ball by swinging her foot? So that's a physical milestone, and there may be a sign of a physical impairment if she's not doing that by that period of time. So our question was, how can technology support tracking all these things for every child in Washington State over a 5-year period, and one that reduces the emotional and financial burden. So remember, we want to get every single child in the state of Washington, regardless of their income or background. And in speaking with the people running this organization, the people from the upper middle class families, they were the ones that they were fine. They were getting diagnosed pretty early, getting their services pretty early. It was definitely the kids that came from the underserved populations that were falling through the cracks and not really getting diagnoses till about kindergarten or so. And usually the idea is that if it's by kindergarten, it's almost too late, because then they really need functional language at that point to be able to kind of keep on top of those things. So there's really this pressure. There's actually a federal mandate that any child under the age of 3 gets free services if they're diagnosed with a developmental disability. But as I mentioned earlier, you're thinking about your kid having a disorder or not being ahead of time, there's a huge emotional burden associated with that. And so we had to think very carefully about how to design the sort of system that parents would be tracking this information and get feedback from people without making them obsess about every little thing that their kid's doing. And then also thinking about the financial burden. So how can we make things that are accessible to a wide range of people? Washington State's very, very broad. We actually had our participants gave us a 4-page Excel printout about every single underserved population. So it included things like people from different cultures, people living on the tribal reservations, people who are in homeless shelters or domestic violence shelters, so all sorts of ranges of people within Washington State. So we had to think about how to approach this from a broad point of view. So our solution is to do this sort of ecosystem of tools. So rather than one tool, we actually have a whole set of tools. So we did some qualitative work to understand what types of things people had access to and try to get the whole gamut of things. And so the idea is getting all this information into the centralized database. And so the coalition we're working with is worried about, once it's in that database, what do we do with it? So they've got a whole system in place for following up with people and getting them connected to a pediatrician or a provider and getting them connected with services. So the problem we were looking at about was how did that data get into the information in the first place? So a lot of populations we looked at had access to text messaging services, so that was a pretty basic service. Websites were pretty important for a lot of people. Lots of people are using Facebook and Twitter for social media stuff. Maybe not the lower income people, but a lot of young people are using these sorts of things, and those are the target populations. But then for people who didn't have access to technology, we have a public kiosk. So the International Community Health Services is doing this model where having a kiosk in their waiting rooms has been really successful. And then the other issue is that face-to-face is also important for a lot of these populations too. So we looked at people who would go to migrant worker communities and go door to door and ask them the screening questions. But right now it's paper-based, and so they have to fill out this thing, type it up, and put it into the database. So we've got some students developing a tablet-based tool for doing that face-to-face communication. So we've been focusing on, we've got prototypes of all these components, but we've been focusing on 3 in particular that we're going to start a study on this summer. So I'll talk a little bit about those. So the web portal, this is still under construction, so so this is a screenshot of it in its current state, but we've got my students who will be finishing it in a month or so. But the idea is that we have sort of a timeline metaphor. So one of the things that we notice is that a lot of these milestones, while they're good for medical purposes, they're also really important milestones to celebrate in a child's life as well. So when you fill out the questionnaire, you have the option to add it to a timeline that shows up about your child's information. So it's very much about chronicling your child's life on these sorts of things. And so you can kind of scroll and do those sorts of things. So we have the developmental tracking information, but we also want to combine it with the sentimental record keeping as well. So lots of parents are taking pictures of their kid or tracking things like first trip to the zoo. So if we combine those sorts of things, we can reduce sort of that emotional burden associated with the medical tracking by combining it with the fun stuff that parents also want to do. So parents can add memories, videos, photos, add that to the timeline as well, and sort of curate this sort of timeline about things that are going on. We have a way of embedding this onto a website. If you want to add it to your blog, we can also make it on a publicly sharing thing, so you can add it to Facebook. We toyed with the idea of posting each thing to Facebook, but our research showed that people who have friends with kids may worry about overshare of every single little thing that their kid does. I know I'm very conscious about it myself, having a daughter now, and I was very selective about the things because I don't want to annoy my friends. So we decided to go with the route of they could share sort of the collection of information as opposed to each and every milestone. The questionnaire is built into the system as well, so you can answer the different questions about when you look at a site, does he look in the direction of your voice? And then you can click add a timeline if you respond to that. In terms of showing how progress is going, we toyed with lots of different visualizations for this. So things like graphs or things like percentiles or all these sorts of things about how do you present the information to people about how they're doing. But all those things had different types of problems. Showing a graph of someone's progress can be really scary. And it turns out that the pediatricians don't even do that. They just tell them, things are looking good. Things are close, but you might do these sorts of activities to encourage that behavior if you're not seeing it yet. But then there's also things where it's like you might want to try and get them screened for this particular disorder. So we have a tree visualization here. So if the tree is fully grown and they're on track, everything's great. They're good to go. And this is going to be most participants. So most of the screening stuff, probably 85% of participants are going to be across the board fine for how the tool is designed and developed. But if they're in these sort of two middle categories, then we show not that they're behind, but that their tree's not yet grown. So sort of have this metaphor of growth, and that it's still a seedling, and so it's got potential to grow, because there are things that you can do. So if they're especially in this middle state, a lot of times they just haven't had the opportunity to do these sorts of things. So things like grasping things, small objects. I was filling this out for my daughter, and it said like, oh, grabbing Cheerios, and it's like, well, I haven't even given her those yet. So that kind of prompted me to go and find some Cheerios and let her to try and practice with those. And then, if they're not yet growing, then that's sort of the thing there. So that's what we're trying to do to sort of minimize that emotional burden associated with things. We also been using social media stuff. So the problem with these is that a lot of these, once your child gets to be older, some of these questionnaires are spaced out by 6 months. And so a lot of times you might go to a website, use it a lot, and then forget about it until you need to do it again. So in order to keep people engaged, we thought about trying to take advantage of things that people are already using. So we also have a Twitter-based version of Baby Steps. And so the idea is that you follow the birth month of your kid on Baby Steps. So my daughter was born in November 2012, and so I'd follow the Baby Steps November 2012 feed. And then I'd see things like this that show up in my feed. Does your baby turn his or her head in the direction of a loud noise? And then a code word. And then I can respond back to that and say, yes, Maya turns her head in the direction of a loud noise with that code. And so that's automatically, we have a tool that's scraping that information and adding it into the database for them automatically. So they can kind of do it when they're doing these sorts of other things. And then similarly, we have also a text messaging based system that does the same thing. So they can sign up to receive text messages and reply back to those, and then we've got a system that will write it into the database. And so it's actually possible to use the entire Baby Step system without the website, without all of that. You can do it entirely through text messaging as well. So that was trying to get at sort of the different sorts of burdens there. So our next steps with this is to study those 3 different technologies this summer, and then finalize the functional prototypes of the kiosk, the face-to-face tool, and the Facebook tool. And we're launching a 1.5-year trial, because the hard part is to do these sort of short studies. Child development takes a long time. And so we're having to do the long-term study route with about 40 families starting this summer. And we're looking at things like the emotional impact of using the sorts of technologies, and how if we did a good job of sort of mitigating the emotional burden of these things, whether or not we're improving access to these for people with financial problems, looking at things like self-efficacy and also patient activation. Does the parent take an active role in managing their kids' health care? Questions about Baby Steps? Yeah, Dan?
Since Kelsey was there, times 100 for everything.
Right.
I'm a super believer in the importance of monitoring developmental milestones. On the flip side, I also I'm probably the only person in this room without a smartphone, and I have an allergy to smartphones. And
right.
I get when you're at the museum, it's sort of sad how disruptive smartphones can be, even with the best of intentions. Taking a cute picture, people just don't realize that 60 seconds then spends type of caption. I wonder if you've thought about how to mitigate. I recognizing the positives in doing this, and I understand the main goal is developmental monitoring, mitigating the potentially disruptive impact of every extra reason you give a parent to touch a smartphone is there's some real risk associated with it.
Yeah, I'm totally with you. I've seen how my daughter sees a smartphone even at 6 months, and it's like she's fascinated by it, and I'm totally totally conscious of it. And so it's hard. It's definitely a hard problem. We've been thinking about it by having a variety of different things that they could do. So they don't have to use a smartphone. They can use some of the other things that they're doing. And we're definitely talking about a small amount of things that people are doing. 30 questions over a 2-month span sort of thing is sort of, it's not even 1 question a day if you're looking at sort of spacing it out at that point. So, but yeah, you're right. If they get that text message while they're playing with their kid, they might be compelled to pick it up. And I think it's still an open problem. I'm not sure how to address it. We're definitely conscious of it, but.
Have you considered how practical it is just defer all interaction, or as much as you can, until kids go to bed?
Yeah.
And photos are still there and all that. You may actually use it as an opportunity to defer all of that texting and captioning until after bedtime.
Oh, that's a great idea. So right now we're actually still testing the SMS prototype, and we were actually debating about what time to send the messages every day, and I think that's actually a great idea to
You're asking, at some point you're probably asking them as a milestone question, like when the kids go to sleep, if they're even vaguely consistent, it's an opportunity to...
Right. Yeah, so making sure that, yeah, that's a great idea. So I will tell my student working on that. That's very cool. Other questions about Baby Steps? Okay, well, results will be TBD since we're launching the study this summer, but our pilot tests have been going pretty well, so we're looking forward to that. I've actually been using it to track my daughter's own stuff, and the caveats of using a research prototype for things is that there's a glitch in the database and I lost everything, but it was nice because I actually got to go back through and reflect on it a little bit better. And also one of those things that it gave me sort of faith in the user-centered design process, because I'd been doing all this stuff before I became a parent, and then I became a parent in the middle of it, and then all of a sudden I became the user that I was designing for. And it turns out that I was like, hey, I actually do need this. And so it's kind of nice to think about, like, yeah, I was very scared that after I became a parent, I was like, oh, this is never going to work, and this is terrible. And it actually turns out it's pretty useful for those things. And I am definitely a biased participant, but it has sort of been a nice thing to use for my own daughter. So the last thing I'm going to talk about is looking at sort of that access burden. So we talk about physical fitness for people. A lot of things that there's out there we can do are great for sort of everyday people, but how do you help people who might have a different impairment? So one of my students, Kyle, is looking at how do we kind of lower the barrier to health and fitness for people who are blind or low vision. And so one of the things that we looked at, she did a bit of formative work to look at this, and simple things like even just going to an exercise class can be really, really scary to people because they don't know what to ask. They might be embarrassed about asking for accommodations for things. And a lot of times just things like fitness instructors just don't know enough about how to correct that. So just the thought of going to a class is sort of terrifying for them. They may have never tried it. So what are they, how can we sort of get over that barrier of access for that? We've been playing, so the design question we started out with, how can we encourage physical fitness for the visually impaired in a way that reduces the access and emotional burdens associated with those. So what we've been doing, we've been playing with Connect. You guys are Microsoft, so you're quite familiar with that technology, I'm sure. So there's a lot of Connect yoga games out there already, but we played a lot of them, and almost every single one of them requires some sort of visual thing. So it's like, here's the on-screen body, it recognizes your thing, and it's like you move your arms to match up with the on-screen avatar. Which works pretty well for if you can see it, but if you can't see it, there's some problems with that. And so she actually has been using the Connect toolkit to give audio-based input only for these things. And so she's been using just sort of basic geometry to look at the motion of it and then translate that into an audio-based feedback to people. So in this case, keeping your arms, moving your arms closer to your head if they're out here and moving them out. And things like turning your hips slightly this way, and it was really fun testing this technology. And my poor student Kyle was just like, I was so sore after debugging this technology. But so basically being able to give feedback to people using only audio. And so, for example, her arms are at 45 degrees and need to be raised to 80 degrees. And so it would give that feedback and it would say, good job when you got into that particular point. So that's how audio worked. We also had a verbal, or an audio-based tone that when you got to the right point, kind of gave you a happy little chime that you were there. So we designed this study with a bunch of yoga instructors. So we actually had a yoga instructor record instead of using just speech-generated feedback, we had them record the different prompts. They went through and evaluated the different poses and things that were going on. So it was really great. We just kind of emailed random yoga studios, and people seemed totally excited about this. And so they were able to donate their time to help make this actually a really good thing. They actually had like CDs of like yoga music that plays in the background and everything too. So my student went down to the Washington State School for the Blind in Vancouver and used this with 16 participants. We looked at a couple of things. So participants reported feeling more confident and more likely to try a yoga class after playing it. So they knew what the poses were, and they kind of knew what the correct things were. So they felt much more like, hey, I think I could take a yoga class now. That'd be really great. I think I feel because I understand the pose a little bit more, I'm willing to try that out. The other thing we do is we actually took video recordings of all their poses and had the yoga instructors look at with and without the audio feedback, just looking at the correctness of their pose. The results were not as good as we had hoped in that they were all pretty good, but the poses we were looking at were all fairly simple. There's a limitation of the Connect in that we had to do all standing poses, but laying on the ground with a Connect didn't work out so well. But they also rated the game pretty highly on different standardized scales for measuring games, so we got some pretty good results for that. So any questions about the Connect Yoga study? Yeah.
Have you considered tactile feedback?
Yeah, so we've been thinking about that, but thinking about the physical burden, we're not quite sure what to do with that. We've been mostly focused on it because we didn't necessarily need it. It seemed to be pretty effective with audio only. And when we asked about things like distracting, the noise and things like that of hearing it, people who are usually visually impaired are used to a lot of audio feedback, and so for them it wasn't problematic for them to not use the audio feedback. But I think it would be interesting to explore that if you had a comfortable sort of haptic system.
So audio feedback, as it is, will replace the instruction.
Yeah.
The fact that I can't get instruction visually, but the other key visual, even with roughly normal vision, yoga it's hard to balance, and audio feedback is not going to help that, presumably. I mean, it can help a little, right? But but if there's nothing to grab onto or nothing, and it looked like there's potential hazards if you don't know the area around. You have to clear the area well enough, and so.
Yeah, I think that there's some potential for that. We didn't explore that, but I think that that's definitely room for exploration. But yeah, balance was definitely an issue we did tree pose for one of them, which is a balancing pose. And for them, like doing this sort of pose was actually problematic for someone who can't see. Because a lot of the times when you ask them to do a pose, one of the tricks is to look at a spot in there. So that was problematic for a lot of people with issues with balancing. So we might explore some things along that line. It's a good suggestion. Yeah, Desmi?
Did you look at the, what's the set of linguistic primitives required to get someone into a reasonable or a complex pose? Like, is there a set of primitives that sort of work across the body?
Yeah, so, and that was actually interesting too, because people responded much better to things like metaphors, right? So, when you said like, move your arms closer to your head, there's a lot of things that you might think about, like, oh, like this, or like this or like that. And so when we use a metaphor of like you're reaching up from something in a cabinet, like that actually worked better than just moving your arms closer to your head. So we did a lot of iterating on that. And the other thing that was interesting was like some of these metaphors don't really apply to people with visual impairment. So one of the poses was like move your feet close apart like you're on skis, right? And some of the people had actually been, the blind people do ski, and actually some people, it worked for some people, but a lot of people had never even thought of skiing and like how you're supposed to have it. And so, some of the metaphors worked pretty well, and some of them didn't. And so the other thing that was interesting is that, move a step forward was also interesting too, because for us it might be like this, but a lot of times blind people are so used to taking such small steps, like if they use a cane, that for them it wasn't a big enough step. And so we had to think about like, they actually responded pretty well to metrics, so like take a foot forward, you move forward by 1 foot as opposed to take 1 step forward. Yeah.
You also doing experiments with tones,
Yeah.
sounds like
We
minors
did.
or majors or low or
Yeah,
high.
we used different sort of chimes and things like that, and we'd experiment with things like kind of like a sonar thing. You're getting closer, and then that was just too annoying for people. But we did use sort of but I think we could do some more with that in terms of like different types of tones and how close you are. But just sort of like we did have a simple tone that sort of when they got it right, we'd experiment with like play a tone until you get it right didn't work very well, because that just like people just kept getting frustrated with that. So yeah, but we were playing a little bit with the tone of that. But I think there's some more we can do there. So again, the limitation of this was that we only did 6 standing poses, because again, the floor poses were hard. We did have one person suggest putting the Kinect on the ceiling to do that, so we might try and play with that next to see if that works. Because the other thing that's nice, if you think about things like situational impairments, if you're in a floor pose, sometimes it's hard for you to see anyway. If I remember in my first yoga class, they made us do the rabbit pose, and it's like the one that you're like on your head, and it's like we recommend watching what other people do before you try that yourself, because you can't look around when you're in that pose. So it might be nice if you could do that. So yeah, Scott.
If you put the Kinect on the ceiling pointed down for the floor poses and make the yoga mat out of something IR absorbent, it'll just act like infinity.
Yeah.
So it should be able to segment it.
Okay. Yeah, that'd be great. Yeah, that was a suggestion that we got just a couple weeks ago. So
yeah, just throw like gaffer's tape down or something like that that's IR absorbent.
Yeah, and I think since you have a mat anyway, then you've already got an excuse for sort of instrumenting the floor. So I think there's a nice opportunity for that. So but yeah. Cool. Yeah, this is a fun project. My student's been exploring other sorts of making other sports more accessible for people. The next thing she's working on is rock climbing, which has all sorts of interesting things. So we're still in the sort of exploration part of that, but it's been a fun thing to work about as well. So just kind of in summary, so I talked about 4 different applications and the different types of burdens that we tried to address through the design of the system. So ShutEye looked at sort of the mental, physical, and time-based burdens. Lullaby looked at the privacy, time, and physical burdens. Baby Steps looked at the emotional and financial, and the Eyes for Yoga looked at access and time and emotional burdens as well. So in all the work that we've done, we've kind of come up with some different strategies so, and how to reduce the types of user burdens. So embedding technologies into already existing activities. So like parents were already tracking information about their kids in terms of the sentimental stuff. By embedding it into that activity already, that can be one way of sort of reducing that. So providing multiple technology options. So again, with the Baby Steps, providing just anything that they're familiar with or comfortable with can be a way of using the system, can also provide that. Removing the need for manual logging and tracking as much as possible, but only to a certain point, because a lot of times there's the benefit to actually doing the logging and that you become more conscious of it. And so finding out how you can sort of find this nice balance between automated and manual logging as well. So for things like privacy burden, making the recording methods transparent and make it really easy to delete things if possible, and only record the things that are necessary for central to your goals is important. Reducing the need for on-body sensing. This mostly applies to sleep. There's other things that I think on-body sensing works for, but that sort of thing can be problematic for things, and then user memory is an important thing to think about. So some next steps. So we talked a little bit about burdens, but one of the things that's hard is that these are all kind of retrospective on the studies that we've already did. And so one of the things that we want to do is sort of think about this as, from a model-based perspective. So can we model the different types of user burdens that people might consider, and also what those trade-offs might be. So by maximizing different burdens, you might minimize others, or vice versa. So like maybe if we're so conscious about privacy, then it's going to make it really, really problematic in terms of a mental burden. So looking at what those different trade-offs are and how to maximize those for different possibilities for different applications. The other point is that sometimes people are willing to put up with different burdens if they see the benefit for things. So people might be more willing to track privacy-based things if they know that there's a high need situation for it. So thinking about the benefits as well. The other thing we're doing is that it's hard to measure burdens other than asking people. So we wanted to actually develop a validated measure that we can use for measuring user burden for things. So there's things out there like the NASA TLX and like the technology acceptance model that sort of fit into these. But we're interested in sort of having a combined tool that you can use for assessing this. And then finally, with all the health technologies you've been thinking about, when we do sort of HCI stuff, it's sort of interesting to explore at this level. And the health people that I'm working on, they keep saying, like, yeah, this is a fun little project, but how are we going to test the efficacy? So my next step is sort of thinking about how to take these to the clinical trial level. So we've already been exploring that with ShutEye, just because it's such an easy thing to deploy to large amounts of people. That those are sorts of things to look at that level. Other projects, if you want to ask me about later, I've been working with Fred Hutch Cancer Research Center on a smoking cessation app. I've been working on assessing sleepiness through reaction time tests, and so that kind of gets Dan's point about like maximizing sleep. So we needed a way of, prioritizing sleep, and so we needed a way of assessing the impact of sleep on a regular basis. So we developed an application for assessing sleepiness to objectively measure that. And then 40 Winks is the application for visualizing the impact of sleep deprivation on people's lives and hopefully helping them prioritize that over things. So with that, just acknowledge all my awesome PhD students and, of course, the people who pay my bills. It's good to do. So thanks. I don't know how much.
Time for 1 or 2 questions, maybe.
I can.
Now that Zio folded, is there? I'm totally on this thing. Is there anything else going on that you're aware of that seems like the next exciting thing happening in sleep, particularly in the commercial space? Happening besides? There's going to be 20 things that do the same as Fitbit, but anything else, either on the bedside or embedded in the mattress, the pillows? Is there anything that seems like it's coming out?
So there's a lot of people who look at things like load sensors under the bed. There's lots of people who have been using vision-based systems as well to check kind of movements. There's an app you can get, Sleep Cycle, on the iPhone, that you put the phone on the bed itself and it uses the accelerometers to measure movement. Unfortunately, they don't give you any information. They claim that it's been compared to sort of these gold standard things, but with any commercial application, it hasn't yet been validated. And you see reviews saying like, "Oh, this works great for me," and other reviews that say like, "This, I was out of bed and it thought I was in bed," and so so they do all these tests, and so they've done that. But I think wearable stuff, like in terms of things embedded into the clothing, I think is a really promising thing that sort of you'll get at things like breathing and heart rate, since those can be important for that, would be pretty interesting. I know there's a Somno shirt, I think, that's out there. They only they only have a startup page. It's like, come back soon. So that's sort of something to look at. We've actually been experimenting with doing it completely unobtrusively. So we've been collecting a lot of data on the smartphone itself. We're looking at things like, last time they interacted with the phone, if it's charging or not, if the alarm clock is set or not, and comparing that to a ground truth and seeing if we can predict different, if they're asleep or not, which so far we're seeing some pretty promising results. I think we're not going to get to the point where we'll say down to the minute and you're in deep sleep versus REM sleep, but we'll hopefully at least be able to get, core sleep times and things like that for longer term.
I'm surprised that, given that every company that makes anything now has apps and QR codes. I'm actually surprised that I haven't seen anything from mattress companies or pillow companies or anything like that that are sort of in the sleep business, or pajama companies or sleep trying to do app anything, especially things like Sleep Number doesn't. I'm really surprised. Maybe it's just like hospitals, they're just kind of always 15 years behind by construct, but
I think that's part of that. And like I said, the Actigraph, which is what Fitbit and all these other ones use, took 20 years for the sleep community to finally recognize that was actually a valid measure for sleep, and it comes with all these caveats and FDA approvals and everything like that. And so I think people are just, people will go for the commercial route, that's sort of, and then they'll put slap these little notices like, for entertainment purposes only, or something like that, because they can't say it's for actually diagnosing sleep for that reason. But yeah, Scott?
Do you know if anybody has messed around with the Sleep Number beds? Because they're already built to sense what's going on, right? They already have air chambers that are already hooked up perfectly to sense what's going on the bed.
Is that, I don't know, is that how they, my parents have one, but they actually have to manually control it, but.
It's a whole bunch of air chambers that are connected in such a way that if you put pressure down in one place, it does.
It actually does some smart thing. Okay.
It doesn't do anything that's smart. The only thing it does sense, we have, which is when I went into this sleep mode, I was I'm gonna experiment with every aspect of sleep. You have to, when you say I want to go to 70, it has to actually sense to figure out that where 70 is. It's sensing the pressure back.
And so it is specific to you. It's not just a set 70 for me is not the same as 70 for you, so it does sort of sense the weight.
We weigh different things than 70. The idea is to give a 70 resistance, so it has to sense how much.
Okay, so there's
something 70 no matter what weight is on the bed right now.
Okay, so it's not just everyone.
But you can instrument those channels. And the pressure and changes in it, and it's totally
we haven't
tried it. It's a pretty straightforward instrument.
We should we don't have space in our lab for a mattress, but we might think about it.
Do you know if anybody's done
that? I don't know, I haven't heard of that. I mean, like I said, I think the main things I've seen instrumenting the bed are looking at load cells under the bed itself. People have looked at mats that you can put under there that sort of sense movements and things like that.
There's one of these mattresses are so expensive. They're crazy. It's a regular mattress, forget about something. They're so expensive. I'm just surprised there's not more. When you start with that expensive, you kind of find reasons to throw in $4 more worth of technology to make a marketing pitch compared to your competitor. I'm surprised that mattress is $7.
I'll just order a Sleep Number bed
right now. Disney approved it by his silence.
Yeah, that's a good idea. I didn't know that they had that sort of. I thought it was just sort of a standard thing.
It's super easy to hack. Yeah, it's super easy, and I need a better napping spot than my couch in my office.
Yeah, me too. All right, well, happy to talk with you guys offline about
anything. She'll be around a little bit.
Yep.
Meetings with you guys this afternoon, and she's right across the lake. So
not too far. Thanks.